What is endometriosis? Endometriosis is a disease that is characterized by the presence of tissue resembling your endometrium. And so what is this endometrium? It is a lining of your uterus, and when this lining is found outside the uterus, it causes chronic inflammatory reaction that may actually result in the formation of scar tissue like the adhesions and fibrosis inside the pelvic area and other parts of the body where it is actually present. What causes endometriosis? I wish I could answer you this question, but unfortunately even doctors don't know the exact cause of endometriosis. Currently, we think that the likely source of endometriosis is actually occurring during your development. So when a baby is actually developing inside the womb of her mother, it's that time that endometriosis starts to develop. How do I know that I have endometriosis? So that's really a great question. Endometriosis is something that we can suspect based on the problems that you tell your doctor. So if you are having pain during your periods, pain in the lower abdomen or lower back, pain during your intercourse, pain in passing urine or passing stools, painful bowel movements, and so that is the time when you can suspect. And you can also have a lot of fatigue, bloating, nausea. Any of these symptoms can actually point out to the suspicion of you having endometriosis. So we have ultrasound which can help us to diagnose an endometriosis, but laparoscopy, that's an instrument that we put inside your body, can 100% say that you have endometriosis. Can endometriosis be seen on imaging? Unfortunately, most of the time, no. Mostly endometriosis is the superficial type, and that means that almost it's like sparkling the paint on the wall, and we can't see unless we actually go inside to have a look surgically. But if endometriosis is severe and is actually growing into the organs like your pelvis or your abdomen like bowels or the urinary bladder, this is called deep infiltrating endometriosis, and in these cases we can frequently see the disease either on the ultrasound or on the MRI. What happens if my endometriosis is left untreated? Well, the key thing to remember is endometriosis is a progressive condition, and it will continue to grow and cause worsening of your pain and other symptoms. So for some patients, it means that initially the pain was only limited to your menstrual cycle, but over the time, with the progression of the disease, pain can start to occur outside the cycle also. It can occur throughout the different times of the month with urination, with passing of the stools, with bowel movements, or during intercourse. But that being all said, even though we know that endometriosis is a progressive condition, for some patients it doesn't even progress to a point that we would need to do any treatment, because it's more of a quality of life issue. And if it is not actually impacting the quality of your life, we don't really need to do anything. Can I become pregnant if I have endometriosis? Of course, 100% you can absolutely have children if you have endometriosis. When we talk about infertility, those are the patients who are struggling with pregnancy already. But if we look at the patients with endometriosis, they are able to achieve pregnancy without much problem. So yes, unfortunately, infertility can be associated with endometriosis, but most of the time it's truly not a problem. Thank you.